The term no is a complete sentence. ACOG, which is, again, not an organization that I'm totally fond of, has a committee opinion number 664 put out in June of 2016. It goes like this. The use of coercion is not only ethically impermissible, but also medically inadvisable because of the realities of prognostic uncertainty and the limitations of medical knowledge. As such, it is never acceptable for obstetrician gynecologists to attempt to influence patients toward a clinical decision using coercion. And they go on and they say obstetrician gynecologists are discouraged in the strongest possible terms from the use of duress, manipulation, coercion, physical force, or threats, including threats to involve the courts or child protective services to motivate women toward a specific clinical decision. This is written in ACOG's guidelines, which of course we know they cherry pick the guidelines they want to follow and they ignore the ones they don't. People are helpless. They've just had a baby and somebody's bringing out the injured baby card. And what do you know? You don't know anything. And so this is where calling for something like an ethics consult, all the midwives and the doctors that are attending my seminars didn't know that that was a possibility. I just like your thoughts about, the scenarios for women when they're in that situation where they're being told their baby has to have a hepatitis vaccine or the baby, needs to go under the Billy lights or needs to go to the nursery to be observed.
And the looming threat of CPS.
That is a very real thing. And people of color are disproportionately affected by the threat of CPS. I can't imagine a scenario where when you're threatened with, where they're going to call child protective services, that you would not just fall in the line and do whatever. And that's threatening, coercive, abusive, and completely unjust. Obviously, education is so important. And for all the reasons we just talked about, when you're in the scenario, all of that can go out the window. Providers take advantage of that liminal space. So I can't say enough about, from an ethics perspective, having an additional advocate in the room that, like a doula, if you're able to have a doula, would be extremely important. And just knowing that you have the right to say no. With my hospital birth, I said no to eye ointment. I said no to vaccines. There was pushback around that. And I was pegged as the crazy hippie lady in the room. I mean, there was language like that used, based on informed consent. I listened to all the information that was presented to me, and I knew ahead of time, and that took some prep, knowing that that could be a possibility that I would be giving birth in that environment. Where do I stand? What are my values? What do I want for my care and my child? Informing myself and learning from educators as much in advance as possible. And then when being presented with those options, knowing that I have the right to say no to these procedures.